and Howard ladies. We're back at the beautiful shops of Merrick Park at Dr. Soler Baillo's office. And we are going to be filming part 2 of our EmpowerHer Mari.trilogy podcast. Thank you very much, Dr. Soler, for allowing us to be here again with you today and for your time. After our first podcast, we haven't had an overwhelming response to that podcast with a lot of questions that we left unanswered. And we are here today to ask you some of the most frequent asked questions during that podcast. Okay? So we're going to start with the first one. And many women asked about facial rejuvenation. Can you explain how today's facelift techniques differ from those of the past and how they create a softer, more youthful result?
Thanks, Mary. Great to have you again. It's a pleasure to join you guys. And so let's get into it. So facial rejuvenation, the modern facelift. So the buzzword out there is the deep plane facelift. Everyone's heard about it. Everyone's talking about it. It's a big buzzword. The reality is we've been performing that technique. It was originally invented, let's say, in the 70s by a plastic surgeon in Texas. The deep plane happens to be an anatomical plane. And so actually I have a little show and tell for you guys. So I brought out just a couple of pieces of cloth so you guys can take a look. So what is the deep plane? I think it's important to understand what we're talking about. It is definitely a layer or a plane. So the first, let's think of the face like an onion, much like Shrek. The face has layers. Onions have layers. So the first layer is the skin. So the first thing we would do is lift the skin layer. And then deep to that is another layer called the SMAS. And the SMAS is a fancy acronym for the submuscular, subcutaneous, myocutaneous plane. So all that means is that this layer is in the same plane as all of the muscles of the face that give you expression.
This mass.
The SMAS. Once you get deep to the SMAS, that is the deep plane. So a SMAS lift is taking this mass and tightening it. The deep plane is also taking this mass and tightening it. What they're doing with the deep plane is they're getting under here, going further out and bringing the skin together and tightening both. So it is an aggressive technique. There's a lot of swelling involved, but the best facelift results aren't necessarily due to the technique, but to the surgeon performing the technique. There are many, many great surgeons that have used this mass, an extended SMAS, a SMAS plication, which is folding the SMAS, and then have created beautiful lifts. So let's not focus so much on the technique as in the artistry of the surgeon. Because I think that's really important and it's very specific. So why does it look better in today's world? Is because we are getting into the world of balancing the face with fat. So not only is it the techniques that have improved to some degree, but also the addition of other techniques like fat grafting, which I think we're going to be getting into.
Yeah, actually, that's one of our top second questions.
Oh, wait a minute. So that is the difference between the deep plane and this mass that I have.
So let's go back. So skin, SMAS, is an actual layer of tissue. The deep plane is going under this mass. But the techniques that really work well for facelifting are SMAS techniques. Because at the end of the day, the deep plane also pulls this mass. It just happens to be a more extended dissection under this mass. So that's what's called the deep plane. But at the end of the day, what's being tightened is this mass in all of these techniques. That's what they all have in common. It's called the SMAS. So we have skin, and we don't pull on skin anymore. We pull on this mass, and then we place the skin down. That's what gives them really nice scars and a really natural look.
And does one last longer than the other?
They're all the same. Essentially, if you perform the right surgery on this mass, the scar tissue that holds this mass together is not going to really change too much between one technique and the other. The important thing, again, is how that smash is handled by an appropriate surgeon. Some surgeons are going to do a great job, whether they're pulling a pure smash technique or an extended deep plane. They're all using the smash to get that great result. Now, the neck is a different. So that happens in the face. The neck, you're tightening the neck muscles, and that is a deep neck lift. That's a story that we can also and we normally, so the muscles of the neck are in the same layer as this mass. So these bands that we get over here, they are in the same anatomical plane as this mass. So think of the neck muscles as a continuation of that plane in the face coming down into the neck.
Well, this is so educational because I always thought that when you do a facelift, you pull skin.
The skin and the best scars happen when you don't pull on the skin. You tighten the lower, you tighten this mass, and then the skin is placed down. Wow. So it's a great operation.
It's a long operation.
It takes time. I think some surgeons can be faster than others, but in general, it's a delicate operation that takes time and focus. And I think
Absolutely. So, our second top question was, what role does fat transfer now play in creating natural value, both in the face and in the body, versus the older fillers or implant-based methods?
so. Fat grafting has been around for a long time. It's great. It is fat grafting is when you're taking fat from one part of your body and you're placing it in another part. So it's called a free graft, meaning that you're literally taking these live cells from one part of the body, placing them in another, and they acquire new blood supply. So it's a real graft. It becomes part of you. That means if you gain weight, your fat grafts will also gain weight. So people have to understand that it's a living graft versus fillers that are artificial. And sometimes we've gotten into I think we talked about this before, the world of overfilling. And I think we're really getting away from that. But I think one of the things that provides the best harmony in facial rejuvenation is fat grafting. We're able to address the diminishing volume that happens as we get older in certain parts of the face, like the temporal area, the cheeks, and the jawline. Even though we do get jowly, once you put these back, sometimes you do need to fill certain areas. And there's nothing better than your own fat.
So when you do an operation, when you do these type of operations, if a person has put in a lot of fillers in her face, you are able to take out the fillers at that time.
If I see that someone's had a lot of fillers, because it's very common, especially along the jawline. Sometimes you'll get in there and you'll see the filler. It looks like a jelly. Filler is a substance that absorbs water and it looks like jelly. And sometimes you'll see it in there, but many times it's placed really deep and it's next to the bone. And then you can't get there because remember, we have to stay in the right plane to avoid injury to the nerves. And so if the fillers are in the wrong place, you cannot remove them. But I think what is important is when I do get in there, facelift surgeons get in there, we see a lot of scar tissue that happens from other modalities, like these energy devices, the Morpheus, the thermage, things that are burning the tissues. And these are things that I recommend for women not to do. But we can get into that a little bit later.
I have questions about the Morpheus and whatever, but
Just go ahead.
Oh, you want to get deep? Go
Yeah.
ahead. We'll splice it.
so that's the Morpheus is very popular and everybody's doing it. And you're telling me that you don't recommend it. I go by what you're saying because to tell you the truth, I had very good experience with you. I've seen the work you've done with other people, with other women. Basically, I recommend you. I know that it's not only about your surgery and the way you do the surgery, but there's an artist component here. And I really believe that you do very good work. And so this is, and I'm saying this because, not because, I know you but when you say that the Morpheus, which has so many friends that do that, or that Sculptra,
Sculptra.
Sculptra, that you do not recommend?
So let's break it down. So Sculptra is what falls under being a biostimulator. It's an irritant. So things get clever marketing names. So a biostimulator, by definition, is an irritating substance that creates collagen. And that's because you put a substance under the skin that your body doesn't like, and it causes an irritation and creates scar tissue. So it's a lot nicer to call it a biostimulator than an irritant if you're going to sell it to people for rejuvenating the face. So the number one thing to know is that the collagen that's produced by Sculptra and these other devices that say they produce new collagen, it's scar tissue collagen. It's not normal skin collagen. And it's not happening at the skin level. People don't realize that it's not doing anything for your skin. So we're back with show and tell for this part. So let's go to the skin layer, our first layer, right? So you have skin and there's fat. There's a fat layer between the skin and the SMAS. And that's the subcutaneous fat. That's the fat under the skin. So we're having a laxity problem with the SMAS. This is how we settle. The whole thing just kind of just settles down like that. And so the SMAS procedures pull on the SMAS and bring the skin with it. Or you could pull the SMAS and then lay the skin back down. What all of these things are trying to do is mimic tightening of the face, but they're not working on the SMAS. They're working on the fat layer right here on the skin. And they're not really tightening the skin, they're burning the fat under the skin. So when Morpheus comes in, it's not really doing anything to your skin, it's burning the fat under the skin. When you inject Sculptra into these areas, you're creating scar tissue and playing under the skin. So they're all trying to tighten the SMAS, but they're not. They're just creating scar tissue. And it's a big problem as a facelift surgeon. I get in there and I lift my skin, and instead of seeing this nice plane that normally is a safe place to be, the nerves are under this mess. So if we're here, we're very safe. When I get in here and this is glued down, you're not sure if you're here or here because all of this is now scar tissue. It's glued together. Cement, let's call it. So it makes it for a much more difficult operation. And many women are fooled into getting these, let's say, non-surgical approach procedures. And at the end of the day, all they're doing is harming themselves or putting themselves at risk when they do try to have a facelift, because it does make a big difference when you're in there. When women have had all of these things done to themselves, whether it's threads.
Yes, I hear this.
So threads are going in here and they're temporarily pulling on this stuff, but they're not anchored to anything. They're not doing anything to this mass. So the whole thing was fall back. So it's a waste of money.
And the results are not long lasting either.
The months at best. You get, and then the other thing that happens when you do tighten, if you do tighten the face, there's a little bit of excess skin. When you tighten things with a thread, what are you going to do with that skin? I mean, it's hard to. At the end of the day, it doesn't make a lot of sense. And I think it's important for women to educate themselves in what works and what doesn't work. So burning the fat under the skin doesn't work, because the skin, at the end of the day, the skin is only going to retract as much as it can. And we cannot injure the skin too much. Now, superficial lasers will tighten the surface of the skin some, but those are superficial lasers. Those are called the ablative lasers. CO2, erbium, those can help with superficial sun damaged skin. That can definitely have an improvement, but not as significant as actually performing a facelift.
So, doctor, give us an idea. What are the different types of neck fat reduction?
So one of the biggest things that people notice when they get heavier, or if it's genetic, is the heavy neck, right? And in medicine, this is called the cervical, right, which stands for the neck, cervical, and mental is the chin. So it's called a cervical mental angle. Mm-hmm. So I started doing this type of very refined liposuction of the neck over 20 years ago. And over time, I did so many of them that I decided to trademark the name and call it The Angle, because this is all I have in a sharp angle. So having a sharp angle does a lot. If you have a heavy neck and you remove that heavy fat, it makes you look younger, thinner, and as pretty as you can look.
Wow.
So those are the three. That's why it's so important. And this is why everyone takes their selfies in some kind of interesting angle, because they like that sharp angle. And so the angle procedure became really special too, because as I evolved as a facelift surgeon, I realized that taking out that superficial fat is not necessary. What's really important is the deep neck fat. So remember, we talked about layers on the skin, that you have the skin, the superficial fat, and in the neck in particular, there's a central part that's called the deep neck fat. And that's below the muscles of the neck. And regular liposuction doesn't address it. All of these energy devices don't address it. And so what does address it is you can do it with a surgery, which is a deep neck lift, which is part of a good facelift, where you tighten the muscle, get rid of that fat, and recreate that angle or improve that angle. Or in my situation, I designed a cannula that I can get into that deep neck fat. When you're younger and your skin is elastic, I can get rid of that fat, keep your normal subcutaneous fat alone, which you're going to need later on for your real facelift, and make you look great at a younger age.
That is fantastic.
So there is a limit, though. So I show these pictures, and these are pictures for some of them from 20 years ago, and they're incredible before and afters. And we'll show, and I'm sure Maria will show you a couple that you can see how different someone can look by just removing, I call it the golden fat, because pound for pound, you take out a walnut size area of fat from the neck, it makes a huge difference in erections.
Just a walnuts?
Not even a walnut. Think of a large marble. Think of a large marble right here, and then you take it away.
You're right. Yeah.
So I call it the golden fat. So I think, but realistically, patients have to understand there's a limit. Usually less than 40-year-olds are okay to have this procedure done. Older than 40, we're probably looking at some type of more aggressive surgical intervention.
Wow, very interesting. Very interesting. I just learned something new for my under 40-year-old friends.
I know that fat transfer for me was a patient recently here, and I had my lower bloods done, and you did some fat transfer, and the difference has been significant. I mean, it's like I get calls from people, what did you do? And what we were discussing before recording today is the fact that my gels don't look as savvy as they used to, because now how you explained it to me evens out, or you.
Well, so when a good facelift surgeon looks at a patient is like an artist looking at a sculpture. You look at balance, you look at symmetry, and that doesn't mean that you have to get someone perfectly symmetrical, but you have to see what's strong in the face, what's weak in the face, what needs volume, where should volume be put and taken away, and not necessarily to change the person's appearance, but to optimize who they are. And I think that's a really important point to touch on, is being yourself and getting a better version of yourself rather than, I want to look like this person. When people try to do that, that's a recipe. That's a red flag for me.
No.
Because when I interview my faces, I'm very careful. And I really, someone asked me, what, as an artist, you're like an artist. And it's like, yes, I'm an artist, but I'm an artist with a canvas that speaks to me. So Van Gogh, he didn't have the stars talking to him when he was done with them. And my patients speak to me after their surgeries. And I think it's important for me to set the expectations before surgery of what it is we're trying to achieve. So there's a vision, a unified vision between the patient and the surgeon of what the outcome should be. When we get close to it, that's a home run for them.
And that's the importance, that a person goes in knowing exactly or pretty much what then they're going to get, as opposed to the expectation. And then all of a sudden you have a big problem in your hands. You didn't deliver. I mean, you didn't do this, but what you're doing,
You set the expectations.
you set
right.
the expectations correctly.
And address the issues as natural as possible. It's comfortable. Anything that makes for the best outcome.
Yeah, yeah. Oh, I'm very happy. Also, I wanted that natural approach. Another, even the third top question has nothing to do with the face, or it does, but and we see this all the times because we're always out and about, and we look at some women and we're like, okay, whatever toots your horn. But when it comes to body contouring, how do you help patients achieve balance and proportion without over exaggeration? And that's something that we see in Miami all the time.
So I've been here since 2001, so almost 24, almost 25 years. And I seen there the trends change. So initially with really big breasts, and then you shifted to really big butts. And I did Miami. It's pretty.
And now it's both. Pretty big legs.
So I call it hypersexualization. And this is it's almost, if you look at the animal kingdom, and there's some birds that have big feathers and they're trying to attract mates. I think in a not such a sophisticated way, we've gone to this place where the uniqueness of a personality, like how many books you read, are you interesting, are you this, has been replaced by this hypersexualized appearance where everything is enhanced. You have lips, anything that has to do with sexual attraction is magnified. And it stems a little bit from the performing arts. Like if you ever see any theater, if you go backstage and you look at their makeup, it is so intense because it's meant to be seen from 20 yards away.
Mm-hmm.
And so what we've done is create this illusion of being attracted from so far away, but now it's up close to your face. So you have lashes up to here. You have extensions then to here. You have lips this big, the breasts and the buttocks. So we become hypersexualized in that look. And I think everyone has their choice, right? But at least in my practice, my goal, my vision as an artist is an attractive look, a balance, not overdone. And I think when people do that, two things happen. You're not an individual any longer, because once you do that, they all look alike. Big lips, okay, there might be some nuance in big lips, but the reality is they're just big.
Yeah.
Okay, you lost your individuality. Once you start overfilling the face, everyone starts to look the same.
Yes, that's what I think does.
And so in Miami, especially, you go out and everybody's just wearing a different color dress, perhaps. But there's a very similar pattern when you go out, and it's important and there's a social pressure. Why does this happen? Because there is a social pressure. There's a dynamic where we as social animals like to be in what's called the survival group. And the survival group, some people think that that's what you need to have to survive, to be hypersexual looking, right? So I don't want to compare people to baboons' butts, but but at some point we're doing the same, calling out your, look how sexy I am. I'm that soul. So.
Yep. Yeah, that is so true. And then they all look alike. But unfortunately, that's what.
And it's especially in this region. There's certain cities in the United States that really stand out for that.
Well, again, the social group makes it happen. So once it's certain, and specifically when you have celebrities that do it, that's usually when it trends. So Dan said the butt thing happened with the Kardashians at J-Well. And bringing that sort of visual into what's considered the ideal. So Kim Kardashian's an icon, and so everyone wants to look like Kim. So Kid, you got big lashes? Everybody got big lashes. Kid, you got a butt? Kid, you got big butts? Everybody got big butt.
Even that it actually.
And so it's and there are trends. So now the trend could be that river butt, and now she's really thin. So now the semaglutides are really popular because now weight loss. Before it actually got trendy to be thick, and now we're getting into the world of super thin again.
Again, that's
Which it is troublesome because you also see a lot of social context with eating disorders starting to trend.
the anorexia.
So it's a social.
You're seeing that now?
Absolutely. There's definitely an
Very famous to be skinny.
there's a huge and so people would call it an abuse of the semaglutides, the GLP-1s, and some people are taking them when they don't need them, just for maintenance. Now, is it healthy? Well, that's a philosophical, ethical, moral question but many people are technically abusing that drug.
I believe
That's designed for diabetics.
Well, of course. I believe, of course.
We see it.
All the time.
No.
Yes, we do.
Fourth question, top fourth question was what strategies or treatments can help prevent or delay the onset of neck skin laxity and sagging, commonly referred to as the turkey neck? Wow, wow, wow.
Gobble.
Yeah.
So the turkey neck comes usually there's a genetic component. If you have it young, you can look at your family and you know it's coming. Yeah, people can see it coming. And so what can you do to avoid it? Number one is not to get heavy.
Absolutely.
Number one is keep your weight stable. Because what happens is let's call it, fat deposits. When you have a heavy neck, you have excess fat cells in the neck. And some people have excess fat cells in their love handles, in their thighs, their butts. So this is having excess fat cells in your neck. So what do you do about it? You don't allow them to expand. Because we have the same number of fat cells in our bodies when we're thin and when we're heavy. They just get bigger and smaller. They're storage units. So when people are heavier in certain parts of the body, they just happen to have more storage units
In the area.
in a certain area. So how do you avoid it? Obviously, you don't store, so you don't get heavy. Second thing that you could do as a young person is you could do refined liposuction, but it has to be done by an expert because, like I explained before, you don't want to take that little layer of fat right under the skin. That is precious fat. So you don't want to take that away because then the skin will collapse later on. And those energy devices that we talked about, they burn that little layer of fat, and that layer of fat is gold. It has an intimate relationship with the skin. So that there are little micro hormonal environments that happen between that fat and the skin layer itself. When you're destroying that, it's very negative. So as far as maintaining this, the heavy neck, preventive, if you get rid of some of that fat early on, you'll have less weight over time in that area, and that will provide a decrease. Obviously, avoid the sun. Extreme sun exposure will damage your skin. And I come from the era like people wore baby oil to the beach.
Can I attend?
And so I think people are paying more attention to that right now, but I think it's important to take into consideration that the sun does do a lot of damage. And especially when you're young and you get those heavy burns, those are the ones that really show up later on. Those early sunburns that were very, very damaging, that's the future scar tissue that we see.
Look at that. That's in your teens. I'm sorry.
No,
That's in your teens, even as a child. Oh,
That accumulates.
the sun works.
And then remember in back in the beach, you couldn't move for 2 days.
Oh, absolutely.
So sunburn.
Absolutely.
now going back to the early, when you do lipo, when you're still young, that doesn't fix the laxity and the
Correct. As a young, like all liposuction, really important. Any type of liposuction or fat reduction. So whether it's, done by machine, by liposuction, people were doing it with cool sculpting, which was, never a good idea. If you get rid of the fat under the skin, if the skin has the elasticity to retract, you're going to do okay. If the skin doesn't have the elasticity, that's when you start having skin wrinkling, bunching up, etc. And that's really important to know that when I analyze someone for neck lipo, it is really important that I am honest with them and saying, your skin will retract or it won't retract. And then we need to do a more invasive operation. But the surgeon has to be, so imagine layers of people that have to be honest with you. You go to a dermatologist or some med spa, you have to trust them to be honest with you. You're going to be tough. Because you'll have a lot of excess skin and they'll tell you, don't worry about it. This is going to tighten your skin right up. And you get all the way up to where your surgeon has to be honest with you as to what procedure he's willing to do.
So, excuse me, I have heard of some procedures that supposedly they take away the fat, they burn the fat, and they say that they tighten the skin immediately. You don't believe it?
So again, the skin is not what's being impacted, is what's under the skin is being burnt. So the skin looks like it's tightening up because it's being held by the scar tissue. And so it appears that the skin tightened up, but they're not really burning the skin. They're burning the tissue under the skin. And then that's when I don't like those procedures.
Okay. Well, the fifth and going to be our last question for you is, what would you say to women who want a more refined look but fear judgment or stigma that's still sometimes attached to plastic surgery? Some of the people are just scared.
Well, there's a full range and spectrum of women that come in, their concerns regarding cosmetic surgery. So I'm dealing with not letting people do too much. So that there's the stigma of plastic surgery, and then to me there's the stigma that you've had plastic surgery. So to me, as what I consider myself an ethical doctor, and I think it's my job to counsel my patients and guide them in the process. And personally, I think it's my part of it is my responsibility not to perform things to such an extent just because someone's asking for it.
Right.
If somebody, I've had one of my patients that brought me her 17-year-old daughter to get her lips done. And, I won't do that. There's certain things I think we took an oath as physicians, above all, do no harm. And I don't think that's being followed by everyone.
No.
Because not everyone that's doing this out there took an oath. And not everyone that took the oath is following the oath. So I think it's important to find someone that truly believes in what they're doing and brings it to the table to help guide you. And as far as the stigma, I think that's part of if you have something done that's done correctly, you shouldn't look surgical. So you shouldn't live with that stigma. Now, if you overdo it, that's when you went. Technically, now people are asking for it.
Yeah.
That's very interesting. I know of some ladies that hang around with their pictures of when they were 19, when they were 18, and they want to look the same, and they're in their 60s.
And there's such a thing as turning the clock back. What I don't like is when you promise someone that you're going to take the clock back and you're just going to fill their face, and you're not even close to being the person. You don't even look like that person anymore.
Right.
You're looking like everyone else.
Yeah.
You don't even look like yourself. It's horrible. I could have seen them. Well, thank you so much for your time today. Howard Ladies, stay tuned for part 3, where we take Dr. Soler Baillo to his famous drawing board, and we're going to talk about the body, the breast. So stay tuned. Thank you, doctor.